Chronic health conditions like metabolic syndrome and type 2 diabetes are rising steadily across the population. In 2015, the IARC classified processed meat as a Group 1 carcinogen, placing it in the same risk category as tobacco and asbestos based on its association with cancer. There is a striking disconnect at the center of this crisis. Despite these health trends, every additive used in those foods has been legally certified as safe by the European Union under Regulation 1333/2008. This safety is established using the Acceptable Daily Intake, or ADI. A single substance undergoes controlled experimental studies to find the level where no adverse effects are observed. As long as proposed use levels stay below that threshold, the additive receives a passing grade. However, industrial food production rarely uses substances in isolation. A single product often contains a cocktail of 3 to 10 different additives. Modern dietary patterns combine these substances across numerous product categories, leading to cumulative exposure that can last for decades. This system is highly effective at preventing acute toxicity, ensuring that a single meal won't cause immediate harm. The question currently facing researchers is whether this same model can account for the long-term biological load created by a multi-additive diet. The human digestive tract does not function like a sterile laboratory test tube. It is a complex environment where additives are introduced into the body under highly acidic conditions and alongside various other chemical compounds. This environment gives rise to the matrix effect hypothesis. It suggests that ingredients which are safe when tested individually may interact unpredictably once they are combined within an industrial food matrix. We see specific evidence of this interaction in how nitrates behave. While nitrites are used to preserve meat, they can interact with amines under acidic stomach conditions. This process can lead to the formation of nitrosamines, which are known potential carcinogens. Similar interactions occur between industrial emulsifiers and dietary salt. Research indicates these combinations can alter mucosal integrity and increase intestinal permeability, effectively eroding the gut barrier through synergistic effects. These interactions represent a structural uncertainty gap in current toxicology. Because ingredients are evaluated largely in isolation, the biological effects of their combination remain outside the scope of standard safety assessments. If these cumulative reactions are a known factor in biomedical research, why are they absent from official regulatory evaluations? The answer lies in the dossier-based system. Under EU law, the applicants themselves must provide the safety data. This often relies on proprietary studies that focus on establishing toxicity thresholds rather than investigating chronic biological shifts. While regulators look for traditional toxicological endpoints, independent biomedical research is tracking long-term health markers that are not currently required for a standard safety dossier. This chart compares the requirements for a standard safety dossier against the endpoints used in independent research. The regulatory model focuses on acute thresholds, while biomedical studies prioritize markers like sonulin for gut permeability, HSCRP for systemic inflammation, and 8-OHDG for oxidative DNA damage. Regulatory frameworks are designed to identify thresholds for single substances. Human biology, however, is subject to a cumulative physiological burden, where low-dose exposure across multiple additives can contribute to chronic inflammatory load over time. Because additives are only tested in isolation, the long-term impact of consuming these multi-substance matrices over a lifetime remains a scientific unknown. The true effect of this modern dietary cocktail is only observable through the real-world exposure of the general public. To address this, a multicentric independent evaluation model has been proposed. This model would monitor 1,500 adults for up to 24 months, using open-access microbiome simulation and human biomonitoring to capture how real-world additive matrices affect the body. The objective is to integrate this independent academic data into the governance process. By utilizing transparent, pre-registered protocols, the system can expand its methodology and strengthen public confidence in how food safety is governed. Current EU law already contains the legislative instruments necessary to address these emerging scientific concerns and force a re-evaluation of existing standards. Article 21 of the General Food Law allows for the re-evaluation of additives based on emerging evidence. Additionally, the precautionary principle mandates that when there are reasonable grounds for concern about a health risk, regulators must act even if scientific uncertainty remains. Citizens can engage these laws through European Parliament petitions or the European Citizens Initiative. These tools have already been used by millions of people to demand that EU institutions address public health concerns through more transparent, independent research consortia. Shifting from isolated laboratory tests to real-world dietary exposure models is a necessary evolution. It allows for a safety framework that accounts for the complex reality of how we eat today.